Hey there. Let's get real for a second. Pregnancy is an emotional roller coaster. And with so much going on, it's not surprising that stress creeps in, whether it's from work, family, or just everyday life. But here's the burning question: can stress actually cause pregnancy loss? You may have heard conflicting advice. One expert says stress isn't a major factor, while another says it could play a role. So, who's right? Should you be worried if you're feeling overwhelmed? Let's dive in and break it all down, because this is about understanding, not just facts. The myth versus reality debate. Now, one of the first things we need to address is the big elephant in the room, the myth that stress alone can cause pregnancy loss. This belief can make a lot of people anxious, even though pregnancy loss is usually due to other causes. According to the American College of Obstetricians and Gynecologists, ACOG, pregnancy loss often feels like a random, heartbreaking event, and many of us instinctively search for something to blame, like that stressful day at work, a sudden fright, or even an argument. But here's the truth: these things are almost never the direct cause. However, stress does have some influence. In 2017, a review of multiple studies suggested that intense, long-term stress could increase the risk of pregnancy loss, especially in early stages. So, it's complicated. Stress alone isn't the villain, but it may nudge things in the wrong direction when mixed with other factors. Why? Hormones. The hormonal connection. Stress flips a switch in our bodies. When you're stressed, your body releases cortisol, the stress hormone. And while cortisol is useful in small doses, it's part of our natural fight or flight response. It can become problematic if it sticks around too long. For pregnant people, too much cortisol can affect the placenta and interfere with other critical hormones. Imagine a well-oiled machine that suddenly gets sand in its gears. That's what high cortisol levels can do to your body. The placenta, which is supposed to nurture and protect your baby, could struggle to function as it should, making pregnancy harder. So, while stress isn't the direct cause, it can trigger a chain reaction that complicates things. It's like putting too much weight on a bridge. It might not collapse, but it's under pressure. The real risks of stress during pregnancy. Here's where we get into the nitty-gritty. Stress doesn't just affect your mental state, it can have real, physical consequences during pregnancy. And we're not talking just about the baby, but your health, too. One common issue: high blood pressure. Stress can push your blood pressure up, and during pregnancy, this is a big deal. High blood pressure puts you at risk for conditions like preeclampsia, eclampsia, and even stroke. For your baby, high blood pressure can lead to preterm birth or low birth weight, which isn't what anyone wants. Then there's eating habits. Some of us eat more when we're stressed, others lose our appetite completely. Neither is great for a developing baby. Gaining or losing too much weight can bring complications like gestational diabetes or early labor. And finally, risky behaviors like drinking, smoking, or even turning to drugs can sometimes increase when stress becomes unbearable. It's a slippery slope, but these choices can be devastating for both you and the baby. Stress can push people into dangerous territory, even when they know better. Natural stressors in pregnancy. Let's face it, being pregnant isn't exactly a walk in the park. Even if you're overjoyed to become a parent, pregnancy comes with its own built-in stressors. Think about it: you've got physical symptoms like nausea, back pain, and extreme tiredness. You're watching your body change day by day, and your hormones are bouncing around like they're on a trampoline. Then, there's the looming thought of giving birth. That's not even mentioning the what-ifs that pop into your head about caring for a newborn. It's a lot to handle, and stress in these situations is totally normal. But here's the good news: most people who experience these typical stresses during pregnancy go on to have perfectly healthy babies. It's when stress sticks around and becomes chronic that we start seeing the potential for problems. Managing stress like a pro. Let's say you're feeling overwhelmed. What should you do? First of all, don't wait to seek help. Stress is something we all experience, but if it's persistent and intense, reach out to a healthcare provider or mental health professional. Sometimes just talking to someone can help lift a huge weight off your shoulders. But let's also talk about the little things you can do each day to keep stress at bay. Stay connected, lean on your friends, family, or even online support groups. Sometimes just knowing you're not alone can make all the difference. Eat well. Eating regular, balanced meals can help you feel more grounded, physically and emotionally. Get moving. As long as your doctor gives the thumbs up, try some light physical activity. A walk or some prenatal yoga can do wonders. Practice mindfulness. Techniques like meditation or breathing exercises can help calm your mind and body. It's a way to remind yourself that, yes, you've got this. Sometimes, joining childbirth education classes, whether in person or online, can ease some of the fears about labor and delivery. Knowledge is power, after all, and knowing what to expect can seriously lower your stress levels. Causes of pregnancy loss. What's really behind it? Let's switch gears and talk about some of the actual causes of pregnancy loss. Understanding this might help ease some of the guilt or self-blame that can come with stress. After all, there's usually more at play than a stressful day or two. There are several potential causes of pregnancy loss, and often, they remain unknown. But here are some of the more common ones. Polycystic ovary syndrome, PCOS. PCOS can cause hormonal imbalances and larger ovaries, increasing the risk of pregnancy loss. Problems in the womb. Fibroids or an irregularly shaped womb can cause complications, particularly in the second trimester. Weak cervix. A weak cervix, often due to surgery or injury, can cause it to open too early, leading to pregnancy loss. Placental issues. Problems with the placenta can prevent the baby from getting the nutrients and oxygen they need, leading to complications. Medications and substance use. Certain medications, smoking, alcohol, drug use, and even too much caffeine can increase the risk. Health conditions, diabetes, thyroid disorders, and infections like food poisoning or STIs can also be culprits. When to seek medical help. It's important to stay in tune with your body. If you notice signs like vaginal bleeding, cramping, or a sudden disappearance of pregnancy symptoms, don't wait, contact your doctor. These can be signs of a pregnancy loss. If you experience intense pain or think you might be having an ectopic pregnancy, get help right away. This is when the fertilized egg implants outside the womb and can lead to severe complications, including internal bleeding. In conclusion, what's the takeaway? So, let's wrap this up. Is stress a factor in pregnancy loss? The answer is, it depends. Stress alone, in most cases, isn't the main culprit. But severe, ongoing stress could contribute to other issues that might increase risks for both you and your baby. That's why it's important to manage your stress and focus on your health, both mentally and physically. Remember, pregnancy loss is often out of our hands. While it's normal to feel stressed, the key is not letting that stress rule your pregnancy. Keep the lines of communication open with your healthcare provider, and don't be afraid to ask for help when you need it. You're doing the best you can, and that's more than enough.